Cancer refers to a group of diseases characterized by the uncontrolled growth and spread of abnormal cells in the body. These abnormal cells can form tumors, invade nearby tissues, and potentially metastasize, spread, to other parts of the body. Cancer can occur in any part of the body and can affect various organs and systems. There are more than 100 different types of cancer, including breast cancer, lung cancer, prostate cancer, colorectal cancer, and leukemia, among others. Each type of cancer has its own characteristics, symptoms, and treatment options. Causes of cancer. Cancer is caused by changes, or mutations, in the DNA within cells. These mutations can be inherited or acquired over a person's lifetime. Some factors that can increase the risk of developing cancer include genetic factors. Certain genetic mutations can increase the likelihood of developing specific types of cancer. Environmental factors. Exposure to certain substances and environmental factors, such as tobacco smoke, ultraviolet radiation, certain chemicals, and pollutants, can contribute to the development of cancer. Lifestyle factors. Unhealthy habits, including tobacco use, excessive alcohol consumption, poor diet, lack of physical activity, and obesity, can increase the risk of developing cancer. Age. The risk of cancer generally increases with age, as cells accumulate genetic mutations over time. Symptoms and diagnosis. The symptoms of cancer can vary depending on the type and stage of the disease. Some common symptoms include persistent fatigue, unexplained weight loss, pain, changes in the skin, a persistent cough, lumps or thickening of tissues, and changes in bowel or bladder habits. However, it's important to note that these symptoms can also be caused by conditions other than cancer. The diagnosis of cancer typically involves a combination of physical examinations, medical history evaluation, imaging tests, such as X-rays, CT scans, or MRIs, laboratory tests, and, in some cases, a biopsy to examine a sample of abnormal tissue. The treatment of cancer depends on several factors, including the type and stage of cancer, the individual's overall health, and their preferences. Common treatment options include surgery. Surgical removal of the tumor or affected tissue is often done when the cancer is localized and has not spread to other parts of the body. Radiation therapy. High-energy radiation is used to target and destroy cancer cells. It can be used as primary treatment or in combination with other treatment. Chemotherapy. Drugs are used to kill cancer cells or prevent their growth. It can be administered orally or intravenously alone or in combination with other treatments. Immunotherapy. This treatment helps to stimulate the body's immune system to recognize and attack cancer cells. Targeted therapy. Targeted drugs are used to specifically target and block the growth and spread of cancer cells. Hormone therapy. Certain types of cancer, such as breast and prostate cancer, can be hormone dependent. It is used to block or interfere hormones that fuel cancer growths. It's important to note that cancer treatment plans are highly individualized, and the specific treatment options recommended may vary based on the unique circumstances of each person's diagnosis. Cancer prevention and early detection are essential in improving outcomes. Regular screenings, adopting a healthy lifestyle, avoiding exposure to known carcinogens, and following recommended guidelines for cancer prevention can help reduce the risk of developing cancer or detect it at an early, more treatable stage. Early detection and screening procedures play a crucial role in identifying cancer at its early stages when it is most treatable. The specific screening methods recommended may vary depending on the type of cancer and individual risk factors. Here are some commonly used screening procedures for various types of cancer. Breast cancer. Mammography. X-ray imaging of the breast to detect any abnormalities or masses. Clinical breast exam, CBE. Manual examination of the breast by a healthcare professional to check for lumps or other changes. Breast self-examination, BSE. Regular self-examination of the breasts by individuals to look for any changes or abnormalities. Cervical cancer. Pap test, Pap smear. Collecting cells from the cervix to check for any precancerous or cancerous changes. HPV testing. Testing for the presence of high-risk strains of human papillomavirus, HPV, which can cause cervical cancer. Colorectal cancer. Colonoscopy. Examination of the entire colon and rectum using a flexible tube with a camera to detect polyps or abnormal growths. Fecal occult blood test, FOBT. Testing for hidden blood in the stool, which may indicate the presence of polyps or cancer. Fecal immunochemical test, FIT. Similar to FOBT, it detects blood in the stool but is more specific to human blood. Prostate cancer. Prostate-specific antigen, PSA, test. Blood test to measure PSA levels, which can be elevated in prostate cancer. Digital rectal examination, DRE. Physical examination of the prostate through the rectum to check for any abnormalities. Lung cancer. Low-dose computed tomography, LDCT. Imaging test using low-dose X-rays to detect lung nodules or tumors in individuals at high risk, such as long-term smokers. Skin cancer. Skin examination. Regular self-examination of the skin to look for any changes, including new moles or changes in existing moles. Dermoscopy. Examination of skin lesions using a special magnifying tool called a dermatoscope. It's important to note that the screening recommendations may differ based on factors such as age, gender, family history, and individual risk factors. It's crucial to consult with healthcare professionals, such as primary care physicians or specialists, to determine the appropriate screening schedule and tests based on your specific circumstances. Additionally, it's essential to be aware of signs and symptoms associated with cancer and promptly report any unusual changes to your healthcare provider, even if you're not currently undergoing routine screening for that particular cancer type. Early detection through screening and vigilance in recognizing potential signs and symptoms can significantly improve the chances of successful treatment. What are the alternative and complementary ways of treating cancer? Alternative and complementary therapies are used alongside conventional medical treatments for cancer. It's important to note that while some of these therapies may help manage symptoms and improve quality of life, they are not meant to replace standard cancer treatments. It's crucial for individuals considering these approaches to consult with their healthcare team and ensure their safety and compatibility with their specific situation. Here are some alternative and complementary therapies commonly used. Herbal and nutritional supplements. Some cancer patients use herbal remedies and dietary supplements to support their overall health and well-being. Examples include ginger, turmeric, green tea, and various vitamins and minerals. However, it's essential to discuss the use of supplements with a healthcare professional, as some may interact with cancer treatments or have adverse effects. Acupuncture. Acupuncture involves the insertion of thin needles into specific points on the body. It helps alleviate pain, fatigue, nausea, and other side effects of cancer treatments. It must be performed by a qualified practitioner. Mind-body practices. Techniques such as meditation, yoga, tai chi, and deep breathing exercises are used to promote relaxation, reduce stress, and improve overall well-being. They can help manage anxiety, improve sleep, and enhance coping mechanisms during cancer treatment. Massage therapy. Massage therapy can provide relief from muscle tension, pain, and anxiety. It is commonly used to promote relaxation and improve quality of life in cancer patients. However, it's important to ensure that the massage therapist is trained in working with cancer patients to avoid potential complications. Energy therapies. Practices such as Reiki, therapeutic touch, and Qigong aim to balance the body's energy fields and promote healing. Mindfulness-based stress reduction, MBSR. MBSR programs involve mindfulness meditation and other mindfulness practices to help patients cope with stress, anxiety, and pain related to cancer and its treatment. Art therapy. Art therapy involves the use of artistic expression, such as painting, drawing, or sculpting, to help patients explore and communicate their emotions, reduce stress, and enhance overall well-being. Alkaline diet. Consuming alkaline foods and avoiding acidic foods can create an alkaline environment in the body, and may help prevent or treat cancer. Note that there is no scientific evidence to support this notion for alkaline diet. Conventional cancer treatments, such as surgery, chemotherapy, radiation therapy, and targeted therapy, are based on rigorous scientific research and have been proven to be effective in specific types and stages of cancer. It's important for cancer patients to focus on evidence-based medical treatments and to consult with qualified healthcare professionals, such as oncologists and registered dietitians, who can provide appropriate advice and guidance. They can help develop individualized treatment plans that address nutritional needs and overall well-being, taking into account the specific type and stage of cancer, treatment modalities, and any potential interactions with diet or supplements. Maintaining a balanced and nutritious diet, rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, is generally recommended for overall health and well-being. However, it is important to remember that dietary changes alone are not a substitute for proven medical treatments when it comes to cancer. It's also important to note that the alkaline or acidic nature of a food does not have a significant impact on the body's pH levels. Therefore, the focus should be on overall balanced nutrition and a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats, rather than trying to alter the body's pH through specific foods. If you have specific dietary concerns or are undergoing cancer treatment, it's recommended to consult with a registered dietitian who specializes in oncology nutrition. Thanks for watching. Don't forget to subscribe, like and share.